Good afternoon and welcome to the 2016 UCLA Fielding School of Public Health Commencement. Thank you to parents, partners, families, and friends of the class of 2016 who join us here today. So many members of our graduating class have come to public health because of you, and they all have succeeded because of you. We are delighted to have you with us, and we're immensely grateful for the countless ways you've participated in the education of so many of our students. So, as we get started, please stand for a minute, parents, partners, friends who have supported the graduates. Thank you. Thank you for all you've done to make their education possible. So, there are many wonderful days throughout the year at the Fielding School, but without a doubt, this is my favorite day of the year. I'm honored to stand here with our incredibly bright, talented, passionate graduating students and to celebrate their achievement. And I'm especially honored knowing how you're going to go out to change the world. It's also, for all of us up here, a little bit of a sad day. You know, we're thrilled at your accomplishments. We're going to be sad to say goodbye. And I know for you, saying goodbye to your friends is also, it's a sweet graduation, but a hard part of the day. So the piece I want to say before we get started, and where we'll end today, is just, we plan on being the Fielding family for you as you do public health for years to come. So come back, call us, call on us. When there are bumps in the road, when there are challenges, when there are successes, when you're trying to change the health of everyone, let us be a team together. I know you're going to be utterly transformative, and I know you're aware that the need for public health is greater now than ever before. There are a wide range of reasons people give. They talk about the spread of pandemics, what we witnessed with the outbreak of Ebola, what we're seeing with the rapid spread of Zika virus, global warming and the health perils associated with it. There are some lights there. Paris was a point of light, but the challenges are going to be enormous for all and most for the marginalized populations. And that's before we get to the rising death rates from chronic diseases and the rising rates of morbidity. So there are many reasons that public health matters more than ever before, but I just want to talk about one very briefly today, because I think the greatest reason that we should all care about public health right now is its commitment to the health of every single person, its foundational belief in valuing every human being equally, regardless of race, ethnicity, nationality, gender, religion, language group, sexual orientation, gender identity, disability, age. We're living in a time with great advances in terms of human rights around the world. And among other things, if you looked at the world's constitutions, every single decade there are more equal rights. If you look at outcomes, poverty has been cut in half under the Millennium Development Goals. More girls are in school. There's less maternal mortality. There are a lot of advances. But as progress happens, we're also seeing a backlash, more hate speech, societal divides that have an impact, profound impact on health, dramatic disparities in life expectancy, some of them widening. In the United States, communities, they're just miles apart with 10 or 20 years difference in life expectancy. But I will say this, which is every single day that I turn on the news or hear somebody saying that not every human being has a right to health, that not every human being is equal, that not everyone has the same right to work, to have a family, to live a healthy and full life, I know, and this is the piece that brings great hope to so many of us, that there is this incredibly powerful antidote, and that's you, the class of 2016. Your commitment to the health of all, to treating all people equally, your ability to work with all communities to transform opportunity and health is absolutely the best vaccine, the best antidote. And we will tackle these problems and issues together. Together as a community comprised of people from around the world and from people from across the country, from every community and every corner of this state, shaped by our life experiences, but not defined by them, defined by our choices that we're choosing to care for the health of all. So while you do, don't forget, though, to take some time out for yourself along the way. Take some time to explore the world, to recharge, to go dog sledding, and to come back and run LA next year, the marathon, with us, please. So, it's my great pleasure to be able to introduce your keynote speaker, who has had a remarkable journey really transforming the health of communities. There is nothing more central to the work of Dr. Robert Ross than what he has done in impact in every corner of this country. He served as a pediatrician, a policymaker, and a philanthropic leader. He currently serves as the president and CEO of the California Endowment, a foundation working to address public health on the front line in communities across our state and at the policy level. It's not a small feat in a state with 39 million. He's doing this building on an extraordinary career. He served as Commissioner of Public Health for the City of Philadelphia, Director of Health and Human Service Agency for the County of San Diego, Medical Director for the Link School-Based Clinic Program in Camden, New Jersey. Under his leadership at California Endowment, they've launched a 10-year, billion-dollar effort to build healthy communities in 14 California communities. He's been named to the nonprofit Times list of 50 most influential nonprofit leaders in America. But more than anything, he embodies this notion that health is something everyone deserves. So please join me in welcoming Dr. Ross.